everyone, you're welcome to my YouTube channel. If you're coming across my video for the first time, Elizabeth Adewe is my name, and if you're a returning subscriber, you are definitely welcome. In today's let's not talk about in today's video. Do also subscribe to my channel, like, share, and tell your friend about it that might need it to attend the video today. In today's video, I am going to be talking on how to make a professional CV for beginner. Yeah, you heard me right. And we are not just going to be talking about it, we are going to be doing it together. In case you've not drafted your CV, we are going to be doing it today together. So just pick your pen and a paper so that you can jot and be writing it down as I am saying it. The first thing I'm going to be talking about is go to Google or Pinterest, anywhere that you know that you can find template on CV. Just go there and download the design that you want to use. What do I mean by that? Here is one of my CV. You can see this particular design, how it's arranged. I saw it somewhere. So the way it is arranged, like I saw it and I decided to use it. But if you know that you are a computer guru or you can design yourself, you can just go there for ideas. So that is the first thing you need. Go to Google and download templates. Thank you. Then this is the second one. You can see it's a bit different. Like the first one I was using, there's no line. This line was not there. Yeah, you can see it's different. So that's what I'm talking about. The design you want to use, how you want your CV to be arranged. Just go to Google and look for templates. The second thing I am going to be talking about is your contact information. Yes, and this comprises of your name, your phone number, your email address, maybe your LinkedIn name. You can put it because I put that on my own. So this is it. Just be writing it down as I am saying it so that you will not forget. This is my name. Yeah, you can try to put your home address too, but if it is an international CV, there is no CV that you want to use in Nigeria, so you might not put it. But even Nigeria too, I think that this particular address used to cause problem. For me, I went for like 2 interviews and I get to know later that one of the reasons why I might not have been picked is because of my address. Imagine you apply for a job in Lagos and you stay in Osogbo, for example. They might want to consider people that stays in Lagos because of accommodation. Some hospitals will not have accommodation with them. So I don't think it is important. But if you think that the hospital you want to apply to is within maybe your state, and you are thinking that can be an advantage for you, please put it. Yeah, you can just like put it there, but then it's not necessary. And some people used to put their age on their CV. Why? Like you don't need it. Nobody need your age for anything. That because of your age, they might not even give you this thing. They might be like you are too old or you are too young. Maybe if you go for an interview and they are asking you of your age, you cannot be telling them. But for to be writing it on your CV, I don't really think you need it. Yeah, because I didn't put it on my own too. So your phone number, if you have LinkedIn account or any means that they can reach out to you, that's just the contact information I'm talking about. Then the second thing I'm going to be talking about is your profile. It means like your summary, the summary about you, who you are, who is this person. For me, I put a compassionate and motivated nursing graduate. So if you are not compassionate, don't think because I'm writing compassionate and motivated you also want to put that. There are other words that you can use, something like industrious. Like I'm an industrious nursing graduate. I am an hardworking nursing graduate, or I am an hardworking licensed nurse. So you can help them to put those ones there. Just look for like words that qualifies who you are. I don't have a prior experience. I just graduated. I don't have any experience in nursing before. I wrote for them that with passion for providing quality patient care. So if I have experience, I can write like with experience for providing quality patient care. So do you get it? Recently completed a nursing degree and eager to begin a meaningful career as a registered nurse in a reputable healthcare facility. I'm a quick learner with excellent communication and interpersonal skills. Majorly, basically, the skills that you know you have, like your skills, problem solving skills, put it there. It's just like a summary of who you are. It's just your bio. Then I go ahead by saying I'm looking for a challenging role with the opportunity for growth and development, because that is what I want in my career. I hope you get it, and I hope you are able to jot things down. I just want you to get it, and yeah, you don't really have experience apart from your volunteering experience and your clinical experience. That's, yeah, or maybe somebody that has gone to school of nursing before. Those people might have experience and you just want, but I don't think they do internship. My profile, or you can write your summary, or you can write your bio, then clinical training experience, or you can write work experience. So for my own, you are going to write the latest one, the latest to the list. I would advise you that it's better to know the dates that you did your clinical posting, maybe your midwifery posting, your psychiatry posting. Like it should be good, like to make your CV to be comprehensive enough. If you know the dates, you just put it from the latest one to the least. That's how you're going to arrange it. For me, the last posting I did, I think it was midwifery posting, and I did it at Jericho Specialist Hospital in Ibadan. That was around June, July 2023. So what are the things that we did here? I wrote for them that monitor the progress of labor and the condition of the mother and baby. So that was what we did here. That was what I did here, and that was what I put there. Assisted the nurse in charge during delivery. I hope you can relate. Provided emotional support and education to the mother and her family. We did that. Administered medications and treatment as prescribed by the doctor. Cared for the newborn baby and educating the parents about newborn care. So those are the things that we did there that I know. If you set line in your midwifery posting, put it there that I set line. Other things that you think you did when you were doing your posting, just help them to write it. Yeah, it's very good. They want to know. The second posting that I did was community posting, like that follows the midwifery posting. You know, I told you you have to write it from the recent one to the less recent. Well, is the word like that. Community posting. So I did it in January, March 2023. So I put it that community health posting experience, rural urban at primary center in. I did my own in Taiwo, Tara, GOPD, Lautech, Ogbomoso, Oyo State. That's where I did my community posting. So administered immunization to infants and children. We did that. I did that anyways. Gave health education to pregnant women in the antenatal clinic. Yes, we told them about things that they should be eating, their health education and all of that. Yeah, I did that. That was why I put it there. Then carried out case study on health condition affecting the client. Carried out health outreaches to school and the community. Did home visiting and follow-up care. I did home visiting actually, but then there are some clients that it's just when they come back to the hospital, just check up on them, like how are you doing, all of that. That's why I put it. I know it's one of the requirements, but yeah, I didn't go to any clients. Yeah, the other one that follow that is Neuropsychiatric Hospital, Aro, Abeokuta, Ogun State. That's where I did my psychiatry posting. So yeah, and I did it in October to November 2021. Yeah, these are the things I did there. I gave health talk on mental health. Yeah, even if you don't give health talk on mental health, a lot of you people have maybe LinkedIn accounts where you just post there about mental health, blah blah blah. It's part of your experience on psychiatry posting. Just put it there. Or when after you are done with your posting, you educate people in your community about it. You can just put it. It's your experience. Assisted in taking patients to vocational training to help their mental health. So we know that psychiatric patients used to do vocational training. So there are sometimes I would just have to follow them there. That was why I put this one there. Involved in documentation, writing nurses notes and proper record keeping. This goes for like the ones I've mentioned too, because after everything you document now, so you can just add it to the points, to the already listed points. So Lautech Teaching Hospital, Ogbomoso, Oyo State. From when you started schooling there, some people started their clinical posting maybe second year, so you put it from that time to when you are done with school. Monitored and recorded vital signs for patients. Assisted with medication administration as directed the registered nurses. You just have to put it there because the registered nurse has to be there as a student to tell you that these are the things that you're supposed to do. So everything that you know you did when you were doing your posting, I'm just trying to like give you points to know what to write. But everything that you know you did there, checking vital signs, administer medication, all of those things, just put it there that you did them. That is part of your experience. Then the second one that you're going to put is if you have any volunteering service, if you volunteer in any hospital, put it there. It is part of your experience. It is your own. Sometimes you can just try to collect reference letter from them that they should give you reference letter. This might need it in the future. Yeah, put it and the dates that you did the volunteering service. It is very important. And if you don't have, there's nothing you want to do. Now we are going to the educational background. Yeah, we are going to start from the highest to the lowest. Maybe you've done your PhD or you have your bachelor degree. I'm going to put it there. But now I'm talking to final year students and fresh nursing graduates. So your school, I'm telling you something, you're copying it down and you're not following me, you're not subscribing to my channel. Do you know how much data I used to edit this thing? Do you know how much data I used to edit this? That's the only way you can support me too. Please just follow me and subscribe to my channel. Thank you. So where are we? So your university that you attended, put it. Your secondary school, put it. Your primary school, put it. Yeah. Professional membership and certification is the next in line. And here, from my school, I have Bachelor of Nursing Science. That's the certification, and I have that. Registered Public Health Nurse. I think they are now with WAEC or something for the membership. Then Nursing and Midwifery Council of Nigeria. I did my RM. I have certificate and my general nursing. So that's about that. Then we are going to skills. Yeah, skills that you have. So for me, assessment of patients. I'm just giving you my own tips, telling you my own. Wound dressing, catheterization, critical thinking. Oh, any skills that you have, like public speaking skills, problem solving skills, any skills that you know you have that is related to nursing. And I forgot under the certificates and something. So if you have all those BLS, you can put it there. So your skills, just put it for them. Then leadership experience. It is very important if you have any. So also some people are the head gear in their secondary school. Some people are head gear in their primary school. Put it there. Just put it. It's your own. It's your CV and your interests, things that you love to do. For me, I love education. I love volunteering. So I put it there. Your spoken language. Put it. And your reference. So your reference, I will not advise that you put your reference on your CV. Why? Because people that you put as a reference, they might want to reach out to them. Unless you are sure that these people will take their call and they know you personally before you can put it. But if they don't know you personally, like me putting the dean of my faculty as my reference, even if they call them, they shall know I'm a student. But then there's no need. You can just write reference available on request, and that's it. So we have come to the end of the video. Please try to give this video a thumbs up, share this video with your loved ones that are in nursing, and do it to subscribe to my channel.